Good morning and welcome, my dear medical students, in this lecture on movements of the human body. Human body is made up of four types of tissues. One is the connective tissue, which is also having a hard and dry part known as bone. Bones form the struts and livers in the body. And muscle, nervous system or nervous tissue, and the fourth type of tissue which is forming the organs in the body. Besides these, connective tissue, muscular tissue, nervous tissue is the epithelium or epithelial tissue forming the covering of the human body and the internal lining of the cavities of the human body. So bone, part of connective tissue, let them move, that is the joints, and muscles make them move. So bones acting as a lever and strut, and the muscles make them move at the joints. A joint is formed by the two bones or more than two bones. When these bones align or articulate, these bones form joints. There are different types of joints in human body, which I will talk in my separate lecture. In this lecture, I will talk about the movements of the human body. There are some basic movements and there are some special movements in the human body. First of all, I will talk about the basic movements of the body. There are some angular movements, the angular movements are the movements which either increasing or decreasing the angle of the joint. So there are basically two types of movements which are known as angular movements. One is flexion and the opposite movement of flexion is the extension. So basically, these two movements are known as angular movements. Flexion, also known as decreasing angle movement or also known as bending movement. So flexion is the bending movement or also decreasing angle or bending movement. When a part of body which is having two flexure surfaces come closer to each other, two parts of a joint are coming closer to each other and decreasing the angle of the joint, known as flexion. Here is human body. And it is having the upper limbs. This is the upper limb. In this movement, the two flexure surfaces of forearm are coming closer to each other and decreasing the angle. This movement where the angle of elbow is decreasing like this. This is the flexion movement of the elbow. So I can say all forward movements are basically the flexor movements, like bringing the forearm forward. It will decrease the angle of the elbow. So this is known as the flexion of the elbow. When I move this head forward and decreasing the angle of the neck, this is known as flexion, and bringing back to its original position is known as extension of the neck. Beyond the normal limit of extension, if I extend it more backward, this is known as hyperextension. So bringing the two flexor surfaces closer to each other is known as flexion. During the embryonic development, the preaxial part, this is the preaxial part of the upper limb, and the preaxial part of the lower limb are facing to the cranial side of the developing embryo, and the postaxial part is directed towards the caudal part of the embryo. But in later part of development, the upper limb bird rotate laterally by 90 degree, and the inferior extremity or lower limb bird rotate 90 degree by medially. So preaxial part in upper limb is directed laterally. In lower limb, this preaxial part is directed medially, bringing the dorsum of foot medially, and in upper limb, bringing the palm facing forward. So flexor surface in upper limb is this anterior surface of the forearm and arm and the palm here. In case of lower limb, the extensor surface is facing forward and flexor surface is facing backward. So in case of lower limb, especially the knee, the flexion is moving backward the leg. When we move the leg backward, this is the flexion of the knee, like this. This is the knee, and here is the foot. So movement which is occurring like this in upper limb. This is the flexion of the elbow, decreasing the angle. This is angle here, and this decreased angle is here. So flexion in knee joint is moving the leg backwardly and decreasing the angle of the popliteal region. In case of ankle, we can see the flexion of the foot upward, that is decreasing this angle. So here is the flexion, but to avoid the ambiguity and confusion, the term used for flexion of elbow, that is flexion of foot, is used according to two different terms used for flexion. So this movement, which is the upward movement of the toes with the foot, is known as dorsiflexion. And the downward movement of the foot is known as plantar flexion. These terms are internationally accepted terms. So when you use the flexion or movement of the ankle in the sagittal plane, please always use the dorsiflexion, that is the upward movement of the foot, and the plantar flexion, that is the downward movement of the foot. So each movement is having its own plane and its own axis. Movement is having its axis and the plane where the movements are occurring. This is the plane of the movement and this is the axis of the movement. The axis, imaginary line where the part of the body is moving, is known as axis, and this is the plane where part is moving. So axis and the plane are perpendicular to each other. This is the plane of the movement and this is the axis of the movement, and both are perpendicular or at 90-degree angle to each other. So all flexion and extension movements are taking place in the sagittal plane. Body is divided in 4 basic planes to describe the movements of the body and to describe the relative position of the organs of the body. The median plane, which divides the body in 2 right and left halves. This is passing from anterior posterior from this longitudinal plane or the lengthwise plane. So this is the median plane. Any plane that is parallel to this median plane. So this is the median plane. Dividing the body in right and left halves, equal halves is median plane. This plane is also known as the mid-sagittal plane. Any plane passing parallel to this median or mid-sagittal plane is known as the sagittal plane. Mid-sagittal and parasagittal, or the median or sagittal. Any plane which is dividing the body in the anterior and the posterior portions, this plane passing through the coronal suture. Coronal suture is like this. So this plane which is dividing the body in anterior and posterior halves is known as the coronal plane. This plane is also known as the frontal plane. Frontal plane is used during the reading of electrocardiography, especially the limb leads. There are 6 limb leads in the electrocardiogram. The 3 leads are unipolar and 3 are bipolar leads. So these leads are viewing the heart from the frontal plane. So frontal plane and coronal plane are the plane which are dividing the body in the anterior and posterior halves. This is the coronal or frontal plane. One more basic plane is the horizontal plane, dividing the body in the upper and lower parts. The transverse plane is also known as horizontal plane because it is parallel to the horizon, that is the ground. So this plane which is parallel to the ground is known as transverse plane, and this plane is having great importance for radiologists, especially the CT scan and MRI, where they are using the axial plane for the transverse plane. So known as axial plane, and they use the term axial CT or axial MRI. So flexion and extension are the angular movements taking place in the sagittal plane, and the axis is the transverse axis. In case of shoulder, this is the flexion. Bringing forward the arm is the flexion, and bringing backward is the extension, and moving more backward is hyperextension. So this is the flexion, extension and hyperextension of the shoulder joint. The other basic movements are the adduction and the abduction. The other movements are, which are basic movements, are the adduction, read and write like this: adduction, to avoid the confusion. Adduction, add, bringing towards or moving toward, moving towards. And the abduction, abduction, write and read like this: ABDUCTION, abduction, bringing away. Abduction, you all have heard of the abduction, that is taking away or bringing away is abduction. So any movement which is bringing the part toward the median plane. I am using this left arm to demonstrate this movement. I am bringing this arm toward the trunk, or I can say towards the median plane. This is adduction, adduction. And moving away from the median plane is abduction, that is taking away the part from the median plane is abduction, and bringing back is adduction. Like same movement on the wrist joint, this is adduction, bringing toward the median plane, and abduction, bringing away from the median plane. So adduction, that is adding or moving toward, and abduction, that is bringing away the part of limb, either upper limb or lower limb. here is the again this is the upper limb. So this is the adduction and moving the part away from the median line is abduction. In a coronal plane or frontal plane, this movement is occurring in a coronal plane because this plane is the coronal plane and the axis is anterior posterior. So this is the axis and this is the plane of the movement. So this is the abduction and here is this is adduction. So movement occurring in the coronal plane having the anterior posterior axis and the part moving away from the median plane is abduction and towards the median plane is adduction. In case of the finger and in case of the toes, these are used in relation to the in upper limb it is used in relation to the middle finger which is having the axis of the adduction and abduction. So middle finger, this finger is used to define the abduction and adduction in the upper limb. So movements are occurring in relation to the axis which is passing from the middle finger. So adduction and abduction. So this is adduction and here I will draw the abduction. So median axis of movement is this passing through the middle finger. So this is the abduction and this is the adduction in the fingers of the hand. In case of foot, the toes, the abduction and adduction are taking place in relation to the axis or line passing through the second toe. In case of foot, the imaginary line which is used to describe or to demonstrate the movement is the second toe, and all toes coming closer to the second toe is adduction in lower limb and approximating is adduction and spreading is abduction. So we have talked about the four basic movements: flexion, extension, adduction and abduction. The fifth basic movement is the circumduction. Circum is for circular or round. Duction to draw. So movements occurring in a circular manner, or I can say a cone shape. Cone is formed by the distal part of the moving part, and the apex of the cone is formed by the joint. So the combination of four movements, that is adduction, flexion, abduction and extension, is known as the circumduction. So this is the shoulder: adduction, flexion, abduction, extension and adduction. The combination of four movements, that is flexion, adduction, extension and abduction, is known as circumduction. This type of movement is taking place on the multi-axial or polyaxial joints like the ankle joint, hip joint, the wrist joint, where the four movements are taking place like this. Here is the abduction, extension, adduction and flexion. So this movement is known as circumduction, taking place on multi-axial or polyaxial joints like ankle, hip joint, shoulder joint and wrist joint and first carpo-metacarpal joint. In case of thumb, this is adduction, this is abduction, this is flexion and this is the extension. So in case of first carpo-metacarpal joint, this is adduction, abduction, moving forward the thumb, flexion and extension, flexion and extension. The plane should be same, flexion and extension, adduction and abduction. So plane of adduction and abduction is this plane, and the plane of flexion and extension is this one, perpendicular to each other. So in case of thumb, this movement is the circumduction. The fifth basic movement is the rotation. This is the turning or revolving movement around the long axis of the moving part. So sixth basic movement is the rotation. When the flexor part is moving medially and this part become medially after the movement, this is the medial rotation. So there are two types of rotations: medial rotation and the lateral rotation. When the anterior part, I will better call anterior than flexor, the anterior part becomes the medial part after the revolving movement. When the anterior part becomes medial, this is medial rotation, but when the anterior part becomes lateral, this is the lateral rotation. So rotation is the movement of the part on its long axis and bringing the anterior part towards the medial plane is medial rotation. When I move this forelimb in the semi-flexed elbow, this is the medial rotation, and moving laterally is the lateral rotation. Medial rotation and lateral rotation. When I rotate my neck on the atlantoaxial joint, this is the rotation of the head, rotation of the head. This movement takes place on the long axis of the moving part of the body. Now I will talk about the spatial movements. Spatial movements are those movements taking place on the spatial joints and not occurring on the all joints, like flexion, extension, adduction, abduction, rotation and circumduction. These spatial movements are the supination and pronation. The first set of movements, spatial movements, is supination and pronation. This movement occurring in the forearm and hand. When I want to eat something from the plate, when I pick something from my plate, either it may be bread or some other thing, this is the pronation. When I bring this hand toward my mouth to put in my mouth is the supination. So this is pronation and this is the supination. So supination is the palm facing upward in the semi-flexed elbow. See, this is the supination. Bag by putting their hand in supine position like this. And when we pat our hand on a child's head like this, this is the pronation. So movement taking place on the radio-ulnar joint. This is a modified rotational movement. In this movement, there is rotation of radius around the stable ulna. So this is the pronation and this is the supination. When we are lying on the bed, our face is facing upward and we are lying on our back. This is the supine position of the body. When we are lying facing our face downwards and back upwards, this is the prone position of the body. The second set of spatial movement is the protraction and retraction. Protraction and retraction taking place on the temporomandibular joint and on the shoulder joint, or I can say